My name is Pam Steele. I'm the director of PSA Limited, an international management consultancy based in the UK, specializing in supply chain management in the international development and humanitarian sectors, with an emphasis on health supply chains. I want to talk to you about the 7 habits of highly effective health supply chain professionals. My motivation for promoting these 7 habits lies in my own personal journey. I received my first leadership training in 1995 when I was working for World Vision International. It was at this time that I first came to hear about Steve Covey's work. Who was Stephen Covey? Stephen Covey was the well-renowned international management guru who authored several best-selling books about the art of management. His book, setting out these habits, The 7 Habits of Successful People, took the world by storm in 1989. The 7 habits are not simply a veneer that you apply to your actions in the hopes of achieving success. The 7 habits are a step-by-step model that empower you to make decisions and act so that you are always moving towards a known destination rather than reacting to whatever is happening at the time. So what are habits? Since coming across Covey's work, I have applied his teaching and read most of his books, including The 7 Habits of Highly Effective Families. Reading Covey's work and listening to him literally changed the way I approached my work and my life. That's not to say I wasn't already learning about leadership and management before I discovered Covey's habits. From my first job in 1987 in the private sector to my work as head of logistics and supply for Oxfam, Great Britain, I have always sought to find out what makes a great leader and a manager, and to apply what I have learned. So what is a habit? A habit represents an overlapping of knowledge, knowing what to do, skills, attitude, wanting to do it, or knowing why you're doing it. Based on this definition, can you describe one particular habit? It could be a habit you know you have yourself, or one you see in others, and identify each element within the habit: knowledge, skills, and attitude. You can note that down for now. So what are the 7 habits of highly effective health supply chain professionals? Having been so influenced by Covey's teachings, I wanted my colleagues at the International Association of Public Health Logisticians, that is the IAPHL, to be aware of the basic foundational ideas of the 7 habits, which have had such a big impact on my own life. I also wanted to challenge them to cultivate their habits and apply good habits to their own work. I knew that this would involve them changing the image of themselves and of their characters, and changing the way they see their roles as health supply chain professionals. In other words, it would involve producing a paradigm shift. So in June 2014, I moderated a discussion at the IAPHL about the influence of Covey on my life. I asked the people in the group to share with us all, based on their own experience and knowledge, what they would say are the habits of a highly effective health supply chain practitioner. And surprisingly, they had lots of really interesting thoughts. I summarized their contributions under different themes and then analyzed and synthesized all of these contributions. The result is the 7 habits of highly effective health supply chain professionals. Number 1 is proactive. A highly effective health supply chain professional is proactive. What do we mean by this? Which means anticipating the future and doing whatever is in their power to improve the situation. This involves the following elements. 1, take the time to interpret information. A highly effective supply chain professional will identify imminent or probable risk, quantify the size of that risk, and flag it up to relevant stakeholders so that they have opportunity to try to avoid it or mitigate it. 2, monitor and report on supply chain performance, including sourcing feedback on that performance. 3, have a passion for research into supply chain solutions. 4, monitor and evaluate the health supply chain systems, including thinking about how to use available information to inform the supply chain systems and to make the relevant decisions. A good supply chain practitioner should have an interest in collecting good quality data where possible, and in using this data to improve the system. Habit 2, start with the goal in mind. A highly effective supply chain professional begins by having in mind the end goal to be achieved. This is the customer's end goal and aim. For example, saving lives. It is the end goal rather than any single step in the process that needs to be the focus. Thus, it is the end goal of saving lives that matters, not how many boxes are delivered from A to B. The boxes could be delivered late, damaged, or empty. They would still have been delivered, but lives would not have been saved. 1. Be guided by an overall supply chain strategy. 2. Always aim to produce the best value. 3. Be customer-focused or patient-focused. So a highly effective health supply chain practitioner is one who is always aware of state-of-the-art supply chain concepts and best practices. At the same time, during his or her actual implementation of these concepts and practices, he or she is not trying to copy and paste other sectors, individuals, or countries' performance, but is all the time endeavoring to identify and apply supply chain management techniques and practices particularly suited to the supply chain environment in question, looking at cultural, geographical, political, infrastructure, etc. Habit number 3, listens first. A highly effective health supply chain professional is slow to speak and listens to others when making decisions on issues. To influence and help others, you must first actively listen to them and understand their situation and concerns. This means being humble and approachable. How do you do this? 1. Talk to workers to find out what are their challenges and how to help them. 2. Be sensitive to and respond to user needs. 3. It's important to have knowledge about supply chain tools, but in order to make a good use of such tools, you need to have the ability to effect changes on the part of internal or changes in the supply chain alongside internal and external stakeholders. 4. Every Monday or whatever suitable day, meet with key focal personnel in the supply team to get updates on project progress, issues, challenges, and recommended solutions. That is purchasing, warehouse, finance, distribution, and human resource. Habit 4, plans and prioritizes. A highly effective health supply chain professional plans and prioritizes activities. Good planning and prioritizing will usually save you a lot of work later. Decide which of the roles and goals are most important, then determine what steps will best achieve these goals. You must be bold and move fast, and have the courage to change the plan if the first plan does not work. A highly effective supply chain professional stays flexible. This means having a strategy and being disciplined, but at the same time adopting a flexible format or not applying a plan too rigidly so that you can change track, which allows you to change when the situation demands. 1. Ensure that the commodities that will expire first are issued first, while working to maintain stock levels between maximum and minimum inventory levels. 2. Monitor speed and quality. 3. Ensure you put together an essential drug list and maintain this list throughout the project. 4. Check dashboard daily regarding key areas of importance that are relevant to your political environment. And 5. Make decisions relating to the following trade-offs. A. Centralization of stock versus delivery frequency, quantity to be delivered. B. Delivery frequency versus cost of logistics distribution. And C. Computerization versus a user-friendly, simple system and staff expertise. D. Unloaded stock size. Delivery frequency versus local storeroom space capacity, etc. Other things we need to look at in relation to medicine supply are A. The prescribing pattern. In many cases, say for example, doctors' turnover will affect the rate of consumption of specific items. We need to bear this in mind in order to reduce stockouts or expiry of medicines as much as possible. B. Seasonal change. In rainy seasons, as it is in many parts of Africa, many areas are unreachable. So early supply sufficient quantities is recommended. C. In a medicine market that is not regulated, you need to monitor the market stock of specific items to make sure you obtain the best price at the suitable time. Habit 5, embraces innovation. A highly effective health supply chain professional embraces innovation. This means balancing experience with new talents and taking the time to rejuvenate yourself so that you work better in the future. What does that involve? 1, keep yourself abreast of all supply chain management developments. Always ensure you understand the supply chain context. 3, always ensure everyone in the team is routinely provided with fresh training and supervision, so everyone stays up to date. Refreshing training and supervision. Habit 6, encourages diversity and collaboration. A highly effective health supply chain professional encourages diversity and collaboration. This means recognizing that 1 + 1 = 3. When 2 or more people come together, they can achieve greater things. So a highly effective supply chain professional is team-oriented and opens himself or herself up emotionally to working with other people. They value cross-functional relationships, actively create a strong team spirit, and address conflicts directly within the team. They are positive-minded. They see challenges as opportunities and constantly seeking new ways of doing things. They also learn from every other person and treat each person equally. No one person is more important than any other than the customer. What does this mean? 1, establish a good communication strategy to ensure there are good communication channels to the stakeholders who will be impacted by your services. 2, focus on the human resources involved in the supply chain activities and delivering medicines, from the technical staff to the support staff. To ensure an effective and efficient system, you need to provide continuous motivation and encouragement of the human resources involved in the supply chain. 3, be effective at collaborating within the organization and with those outside the organization. 4, communication for decision making. You need to have the ability to grab the attention of key stakeholders whenever an opportunity presents itself. This is a skill. You must have your own elevator pitch handy at all times. Speak the language of those you are looking to influence. For example, if you are speaking to a program manager or a doctor or a nurse, then make the connection to service delivery and to the impact on health outcomes. Listen to and study your target audience, be it government, donors, partners, or health workers. Understand where their priorities lie and connect with those priorities. Habit 7, the final habit, considers the needs of stakeholders. A highly effective health supply chain professional considers the needs of all stakeholders and seeks solutions that help everyone. How do you do that? 1, develop and sustain high emotional intelligence. 2, have an eye for quality and promote the use of secure distribution channels. 3, put faces to the data. That is, think about the human beings behind the numbers and be conscious of their safety. 4, invest the time to present data in a way that is visual and easy to relate to. Use data to tell the supply chain story in a way that grabs the attention of decision makers and spurs them into action. So what does this say to you? Can anyone estimate how many health supply chain practitioners there are in developing countries? Think about your role as a health supply chain professional in this context and what impact you might have among your colleagues across the world. In the end, a project manager or a director has, apart from funds and political leverage, only one essential resource at their disposal: their staff. These staff, whether they are professional specialists, support staff, or administrators, don't just need to be managed. They need to be led. They need to be inspired and guided. Staff loyalty cannot be taken for granted, and leaders will increasingly have to defend their role and status, as well as justify how they won the right to lead. What makes a leader isn't the title. It's a collection of attributes, attitudes, and habits that set him or her apart from others. So let's go back to where I started. You noted one habit down for yourself. On a scale of 1 to 10, where do you rate yourself? What's your biggest strength? Do you possess all the habits? If not, which habit would you like to form as a priority? Do you have the knowledge, skills, and desire to form this new habit? If not, write down the steps you need to take in order to achieve the necessary knowledge, skills, and desire to form this new habit. It's your choice. Ultimately, all that we do should be for the aid recipient. That recipient is at the heart of all that we do. Thank you.